Yeah, that's what it's been saying.
Oh. Okay. Okay. Do you want us to start over for the YouTube stream?
Sure. For the benefit of the YouTube stream, we'll redo Judith's introduction.
Okay.
So Judith, again, welcome. We've invited Judith to the table with us today to address any questions that MTEA may have regarding any of the budgeting numbers or specifically the 53% benefit loading factor. Judith, can you give a little bit about who you are and why you're here?
Sure. So it's nice to meet everybody. So thank you for that and good afternoon. My name is Judith Marte. I'm here on contract with the Council of Great City Schools, an organization that supports some of the largest school districts in the country. Prior to my time working with them, I was the Deputy Superintendent of Finance and Operations for the Broward County Public Schools, the 6th largest district in the nation, where I served for 6 or 7 years, sometimes I forget. And prior to that, with the Miami-Dade County Public Schools, the 4th largest school district in the nation, where I was their Chief Financial Officer, served there for 17 years. Before that, I did a stint. I was 13 years with the Lawrence Public Schools up in Massachusetts, in case you can't tell by the accent. And I was their Chief Financial Officer as well. So I've done about 35 budget cycles in my very long career. Aside from that, I work with Government Finance Officers Association and support them in reviewing budget documents for municipalities and school districts across the country. Recently, I've served as the Vice Chair of their National Budget Committee. I termed out, my 6 years were over, and somebody's replaced me. And again, I'm very happy to be here in Milwaukee. It's a really nice community, wonderful people. So looking forward to helping out.
Thank you, and thank you for being here and lending your expertise. Today marks the 5th bargaining session since February 19th, 2026, when the parties exchanged their opening proposals. Throughout that period, MPS has responded to more than 230 written information requests from MTEA across multiple rounds of production. Those topics included teacher and paraprofessional turnover rates for the current and prior 3 school years, AGR classroom counts and compliance status with board policy, class size caps at K-5 first, second, and third grade levels, scope and projected savings of the district's approved position reduction plan, teacher certification and emergency permit license rates, special education caseload caps from early childhood through high school, ESL teacher allocation methodology, class size reduction approach, including co-teaching as a potential site level strategy, the standard of care framework, information regarding teacher licensing, projected teacher retirement numbers, Wisconsin teacher education program graduate data, Montessori staffing needs. In addition, the district provided documents and information, including costing pivot tables for all 3 of MPS's base wage proposals, all 3 of which remain on the table today, which include options A, option B as amended, and option C. Approved and pending critical needs staffing requests, line by line narrative and itemized explanation of the $46 million structural deficit, contracts identified totaling millions of dollars in savings, contingency and reserve fund balances, full transportation budget, bargaining team composition, responses regarding teacher turnover savings, total contract spending for fiscal year 2022 through fiscal year 2026, new contracts approved since March 2025, FY25 audited annual comprehensive financial report, fiscal year 26 RIF analysis, fiscal year 26 grants list, fiscal year 26 transportation awards, and the Millman MPS medical, dental, and vision cost projections. In short, MPS has provided an unprecedented amount of information to MTEA at its request, so that MTEA could fully evaluate the proposals that are before it and come to the table with a way to find an agreement that helps the district find savings while also bringing all employees the full 2.63% base building increase, which again, all of the district's proposals do. We thank you for your response to the additional to the 6 information requests that MPS had provided to MTEA, in which MTEA agreed that the scope of bargaining is limited to base wages capped at 2.63%. MTEA agreed that all 3 of MPS's proposals deliver a full 2.63% base building increase. MTEA agreed that the timing is the only difference between the proposals. I'll note that MTEA did note that a delayed implementation results in a lower annualized wages for the period of delay. It's true, and that's a distinction that the district has been transparent about throughout bargaining. MTEA also in that correspondence noted that it did not dispute the accuracy of the $46 million deficit reflected in the independently audited financial statements. One other question that MPS had posed that was left unanswered, though conditioned, MTEA conditioned the response regarding what revenue sources or counter proposal it may have for MPS to consider on receipt of additional information related to contracts and benefits. To that, MPS responded, reminding MTEA that they were provided with a complete listing of all 3,681 Fund 10 MPS contracts that included the vendor name, contract number, the start and end dates, contract total, the fund that it's applied to, and a description of what the contract's for. Additionally, MPS provided MTEA with a written analysis of the 26 vendors that MTEA identified as potential savings sources, showing that 29 of those 26 vendors that amounted to 51 contracts, 29 of those 51 associated contracts were grant funded, required by law, were allocated in a non-general fund, or were already canceled. So that totaled $20,479,000. The remaining $4,868,000 consisted of speech pathology and PT/OT services, prom and graduation expenses, IEP interpretation services, and work-based learning services for students with disabilities, amongst others. Additionally, MTEA requested a detailed explanation of the 53% benefit loading methodology that the district used in its budgeting process, which was then subsequently provided to MTEA. It's the district's position that MTEA has all the information reasonably necessary to evaluate the district's proposals and prepare a counter proposal. Parties agree on the legal framework. The parties agree that all 3 proposals deliver the full 2.63% increase to base wages. The parties agree that the $46 million deficit is real and undisputed, and the only remaining dispute is the effective date of an increase that every employee will receive. With respect to the 53% benefit number. Just prior to arriving at the bargaining today, I received a copy of a press release issued by MTEA, which disputes the accuracy of the 53% benefit number. The district's budgeting and calculations, including the 53% benefit loading factor, are correct and consistent with both standard public sector practice and federal compliance requirement. The district uses the rate methodology for fringe benefit allocations, pooling all benefit costs and dividing by total payroll, which is a recognized standard for comprehensive compensation budgeting. That approach is consistent with fringe benefit rates across City of Milwaukee departments, including police, which has a 55.06% rate, fire, which has a 53.39% rate, and DPW operations, which has a 50.05% rate. Importantly, MPS is legally required under 2 CFR Part 200 to apply its fringe benefit rate consistently across both federal and non-federal activities. The district cannot use one rate for federal grant budgeting and a different lower rate for general fund planning purposes. Using a selective marginal rate for a wage increase costing, as MTEA appears to propose, would create precisely the kind of inconsistency that subjects the district to audit finding, repayment obligations, and potential loss of federal grant eligibility. The 53% rate is not a choice made to inflate costs. It is the rate the district is required to apply uniformly, and it has been applied uniformly here across every proposal on the table, including MTEA's own. Even accepting MTEA's marginal rate framing for purposes of discussion, it does not follow that the excluded costs represent available funds. The district's health, dental, OPEBs, and SERP costs are committed expenditures for the full employee population. They do not decrease because a wage increase is delayed, and they are not freed up or redirectable by changing the rate convention used for costing purposes. The money is spent regardless of which methodology is applied to the wage proposal. Finally, applying MTEA's rate consistently to all proposals leaves the savings differential between a July 1 and January 1 effective date intact. That differential remains material in a $46 million deficit environment. Finally, I'd just like to recognize that although she very much would like to be in attendance today, unfortunately, Dr. Celius is absent as she is out on bereavement leave. And so our thoughts and best wishes are with her and her family. At this point, I'll turn it over to you, Amy, with the same question that I've asked since the beginning, which is what does MTEA have as a counter proposal to help meet this moment?
Good afternoon. Just for the record, this is our 6th bargaining session, not our 5th bargaining session. And the issue here that we want to discuss is not the comprehensive planning purposes. The issue is the additional costs associated with wage increases. And so MTA is very hopeful that we will be able to come to an agreement today. And to get there, I'd like to make sure that we're on the same page about the basic facts that are before us. So to bring us to today, MPS has 3 simultaneous proposals on the table. MPS calculated the cost to the district associated with each of these proposals. The cost MPS calculated for its proposals ranges from 24.1 million to 28.6 million. Can we agree on that?
What's that? That's correct.
And the administration has determined that MPS can afford these proposals. Is that correct?
That is correct.
And MPS also calculated the cost of providing the full 2.63% COLA to all bargaining units represented by MTEA on July 1st. The cost MPS calculated is 31.9 million. And that's in the original costing document that you provided to us on March 25th. Is that correct?
Which document are you referencing?
This is the March 25th costing document. It looks like, I don't know if you can see it from there.
Is that the one that has amended option?
No, this is your original from March 25th.
Okay. What's your question, Amy?
It was just so that you can find it. It was attached to the email this morning that I sent this morning. Do you have it?
Yeah, I think.
Okay. So the cost that MPS calculated is 31.9 million. Can we agree on that?
You sure?
He says this one. That's the number that's on there.
And of that amount, MPS calculated the cost of the actual COLA and step increases as 20.8 million. Are we agreed on that?
That appears correct.
And then MPS calculated that there would be an additional 11 million due to additional tax and benefit costs associated with COLA and step increases. Is that correct?
That looks correct.
And MPS came to that $11 million number by multiplying the wage increases by 53%. Is that right?
Is that correct? What was that?
That's correct.
Yes.
That's correct. But the additional cost of benefits, taxes and benefits on increased wages isn't 53%. Is it?
Do you want to address this?
I asking the question.
I said the additional cost of taxes and benefits on increased wages is not 53%. Is it?
Do you
Do you want to do using the rate methodology that we've historically used? It is. Using the rate methodology that this district has always used, that's the calculation.
Are you asking for if you pulled out specific benefits if the number would be different? Because using the
I'm just,
benefit rate
yeah,
calculation methodology that we explained,
let me just repeat the question. So the additional cost of taxes and benefits on increased wages is not 53%, is it?
It is not that additional incremental cost, but because that's the way the pool has always been built.
Can't really, I'm sorry, it's good to see you again, Judith. I can't really hear you. You're saying it's not 53%?
So the district uses that methodology to apply its fringes universally. So when you look at just the piece of the wages and try to apply a different rate, I understand what I think I understand what your argument is or what your thought process is. That the cost for health insurance is the cost for health insurance on a per employee basis. I think that's what you're arguing. So if you take that out, it's really only 17%. Is that kind of what your logic is? And what I'm saying is,
I'm just trying to have, I know we can talk through disagreements, but I'm just asking the question, and it's a yes or no question.
so if you're asking me for a yes or no question, the answer is based on the methodology the district has used forever, which is a common methodology for budgeting, then it is 53% because it's a blended rate.
So then your answer
Is yes.
is yes.
Yes.
And most of the cost MPS included that brings your calculation to 53% is associated with healthcare expenses. Is that right?
Yes.
yeah, healthcare expenses are a large percent of the very rich benefit package provided for teachers and MTEA members.
And those expenses don't increase at all when you increase workers' wages. The expenses that increase along with wages include things like the employer share of taxes and pension contributions, but not healthcare. So MTA has calculated the actual cost of benefits and taxes associated purely with increased wages as 17%. And we provided those calculations to you this morning. Based on that calculation, using MPS's own numbers, the true cost of the taxes and benefits associated with the full cost of living isn't 11 million, it's 3.5 million. And that puts the total cost of MPS providing the full cost of living on July 1st for all workers represented by MTEA at 24.4 million.
So based on the fact that they're using a blended rate, you can't bifurcate part of it for a section of wages. If you were to look at it as two pots and say, we're going to build, so there's two ways you can build your budget around benefits. The way the district does it, where they use a completely consumed blended rate, or some districts use a rate that says the portion that you've assigned to 17%, and then you've got a premium equivalent rate to the value of health insurance at $20,000 an employee a year. When you put those together, that comes to an effective rate. The district uses the effective rate. So you can't parse out a piece of it and say, well, no, the 53% rate only applies to everything else. It doesn't apply to this race. If you were to do that, then the rate might be 55% to cover everything else. When you use a blended rate, everything's in one pot. You can't bifurcate that pot. That's established based on the total historical calculation of the district, fully including the cost of the health insurance.
So I'm asking about real dollars though.
I'm talking about real dollars.
So you provided us with the cost of taxes and benefits that you calculated.
That the district
That the
calculated.
district
And
calculated.
I verify is correct.
For the increased cost of the wage increase. But that amount is not correct. That's not how much it costs. Do you agree?
It does cost that. Well, first, the other thing that we haven't even brought up today is in the macro budgeting that we discussed, I believe, at a recent workshop with the district where we put in the line items of what the budget cost increases and revenue increases are for next year. There's a $20 million increase in the cost of health insurance for next year that's got to be covered. So that's not even in the discussion here today. That 3% is actually going to get higher because you've got to cover all those costs.
So you've already split out and budgeted the 20 million for the increase.
It's going to be embedded in the fringe rate. We're embedding it in the fringe rate now. That was based on the actuarial, what the actual cost is. Now we have to bake that into the fringe rate going forward. That's the way the district budgets. And as the attorney said, it is a very common practice here in Wisconsin and quite frankly in other big districts to bake in a rate that is your fringe rate.
Okay, let's go line by line.
You have a document you're referencing.
Yes, we sent this to you this morning. Let me give you the title.
This table is moving and driving me crazy.
This is in the 9/28 email that we sent.
Is this the MTEA?
The Excel sheet?
Yeah.
Thank you.
You're welcome. So I'm going to read the MPS description of each line item, and then I would like for you to tell me what it's for, and whether in real terms it increases in correlation with wage increases.
So I'm happy to describe what each thing is for you, Amy, but you're asking me to answer a question that doesn't align with how the fringe rate in this district is built. So if you were to ask me, does the cost of health insurance increase with the cost of wages? In isolation, that answer is no. But when the fringe rate is calculated that consumes all of it, then the answer is different because the 53% rate is a total rate. If the district would have changed their methodology around building the budget, then the rate for the related costs that are not health insurance related would be much higher. They blend it. So I'm not sure I'm going to give you an answer that makes it clearer, but I certainly will try. I haven't.
Okay. Let's start with exempt Social Security salaries. Can you explain what this line item refers to?
I'm sorry?
Can you explain what that line item refers to?
It would be wages paid to employees that are not subject to Social Security.
So when wages go up, do social security taxes go up?
On that particular line item, because it's part of the blended rate, they all go up and come down at the same time.
So your answer is yes, it does.
They all,
But just for this one, for example.
I can't separate out the lines, Amy. The rate is 53% for everything in the calculation.
Can you explain what that means in real dollars? So what I'm asking is,
For every
does
dollar-
that line item increase along with wages?
Yes. For every dollar
does,
paid,
yeah.
for every dollar paid to an employee, the related benefits are 53 cents, regardless of what that dollar is. That's what a combined fringe rate is. For every dollar of pay, the fringe rate is 53 cents. So to pick apart the components of that rate and say, how does this affect it?
But that's not my question. So I just want to stick with my question, which is, in real dollars, does the exempt social security salaries item increase along with wages? And I think you said yes.
It increases along with wages, yes.
Okay, thank you.
Yeah, but I'm
not gonna go.
And then for OASDI, can you explain what this is?
It's the 6.2% employer contribution rate to Social Security.
Thank you. And when wages go up, does OASDI go up
Yes, to a maximum limit, yes.
to a maximum?
Yeah, there's a cap on how much you pay in
Okay,
on the 6.2.
so yes, up to a max?
Yes.
Okay. Thank you. And then can you explain the third item, Medicare?
Amy, are we gonna go through this whole list? Is it MTA's position that you don't understand what these line items are? When we look at medical, dental coverage, prescription coverage, I assume you understand what those are for.
I want to work through this list of about 15 in a thorough, methodical way so that we understand one another.
Which ones don't you understand?
I'm going to proceed in the way that I just described. The fourth item, city ERS pension employer share. What is that?
So I'm not sure I know every single line item here. I think I'm going to need some help. I need to, so obviously I'll follow whatever direction the administration asks, and I want to answer whatever questions I can. But if the question is, does this line item go up? Does this one not? My initial comment about the 53% rate not being able to be bifurcated and picked apart, like this one yes, this one no. If we do that, then the rate is completely different and it doesn't apply. This is the methodology. It is, as the attorney said, an established methodology for building a fringe rate budget. And the 53% is not going to change if we talk about line item by line item.
I hear you, Judith. I hear what you're saying.
Okay.
So we can agree that you calculate the total fringe rate differently than what we're talking about here. But today, just for this discussion, we're talking about MPS's calculation for the additional cost associated with wage increases. That's what matters, is can MPS afford this or not? MPS represented that this wage increase will cost 11 million. And we're trying to get to the bottom of whether that's true or not.
I want to just, for the record, I didn't calculate the fringe rate. This is a fringe rate that was established by the district and a methodology that's been carried forward for decades.
I understand.
Okay.
I
I just want to make sure that
Sure,
I've verified it's correct, but I didn't calculate it.
sure, I understand. So actually, before we go to city pension employer share, and I know you said that you're not exactly sure what that is, I want to go back to the Medicare line. When wages go up, does Medicare go up?
Yes.
Okay. And there's no math?
No.
Okay, thanks. And then state WRS pension employer,
I apologize.
no, Judith, do you know what the state WRS pension employer line item is?
I'm gonna ask
I
the,
can see that. So going back to the city one is the employer pension payment for classified staff.
Uh-huh.
And then the state pension is for the certificated staff.
Okay. And thank you, Aicha. And then, so for the city pension employer share, which is, as you just stated, is for classified staff, when wages go up, does city pension employer share go up?
Yes.
Thank you. And when state WRS pension employer, when wages go up, does that go up as well?
Yes.
Thank you. And then MPS MTEA pension supplement teacher CERP. Can you explain what that is?
That's the teacher supplemental plan.
And does that, when wages go up, does that line item go up?
Yes.
How does that, can you explain that? How is that affected?
Yeah, I believe that would be a case by case basis, depending on the individual in that plan. Is that right?
Okay, maybe we can come back to that. So I can just understand the case by case. And then ASC MPS pension supplement MPS, sir.
That's the same. That's the administrator supplemental plan.
And when wages go up, does that go up?
That would be kind of the same explanation as before, case by case.
Okay. And when, here, let me see if I can ask this clarifying question. When you, in response to your case by case response, do you mean that employees who were employed is this related to Act 10 and that cutoff line? So new employees hired after July 1st, 2013 are ineligible for CERP. Is that what you're referring to when you say case by case?
Gonna hand it over to Kara.
No, that is correct. The supplemental plans are closed to new employees. But when we do the benefit calculation, it does take into account their average salary over a period of time as well as their years of service. So that's why, as Aisha indicated, you have to look at it on a case-by-case basis when you do the calculation. But new employees are not eligible for those supplemental plans.
Okay, thank you, Kara. So how many employees is that?
I don't have the number in front of me. I can get that number and send it over to you.
Is that pretty readily available to you, like later today or?
Yes, and I believe I did send over the actuarial evaluation for both plans,
Okay,
and the number is in there, the count of how many employees are eligible for those plans, but I can resend that.
okay, I would appreciate it.
Yep.
Thank you. So for the 6.5 million listed for CERP, is that paying out to current employees?
6.5, I'll double check on that. I believe that's the actuarial evaluation of what is expected to be paid, but we'll get clarification on that for you, Amy.
Okay. And then, is the life insurance item, this is a benefit to employees? Is that what's meant by this line item?
Yes.
Okay. And, when wages go up, does the life insurance go up?
Yes.
Okay. And dental active, can you explain what that one is?
It's the cost of dental insurance for active employees.
The cost of dental insurance.
Gross
That's the
cost,
7 gross
not
cost.
including the employee contribution.
Okay. And, when wages go up, does dental active go up?
Using the rate methodology method of budgeting for benefits, the answer is yes.
No, we're asking in real dollars.
Uh,
When wages go up,
Using
does
the rate
dental
methodology,
active?
yes.
Say it, I'm sorry.
Using the fringe benefit allocation method, everything goes up. So the answer is yes.
Can you tell us how that happens with dental
Because the rate
active?
is a pooled amount, is a pooled cost. So it's a very large district. In the end, we have actual costs that are incurred based on claims and all of the things that happen. But when you use a pooled rate, you apply it all the time to all wages. It's a pooled rate based on actual experience. They take the year before and they say, this is what our actual costs were in all these categories. And based on that, that's the rate. So you have to continue to apply the pool. If you try to bifurcate it, you're going to have a problem because the incremental cost for that piece goes way up because it's not part of the pool. Using the pooled rate, everything goes up at the same time.
So I just want to I want to skip down a few. So the health, does the cost of health benefits increase specifically when wages increase for current employees? like, I'm not asking about the accounting. Does that cost actually increase?
Yes. Everything increases when you use a rate methodology of calculating fringes. It's applied universally to all the components of your fringe calculation. The answer is yes.
I'm not asking about the total amount.
The answer is yes when you ask me for each
I'm
individual amount.
asking specifically for the amount attributable to increasing wages.
Yes.
How?
Because it's part of a rate that's set at the beginning of the budget.
And so, Judith, if we continued on line by line, I wonder, I think it could be helpful if you could give me an example, like if we could talk through an example for an employee whose wages increase, let's say $5,000. Does that employee cost more to our benefit plan?
Yes. 53%, yes.
How?
Because it's, I wish it was easier to explain. It's a combined rate that factors in everything. And you apply it universally to all the components of what's in the calculation of fringes.
I'll add to that too, that 3% rate, as I noted earlier, is a system level planning tool. So it's applied uniformly and it's consistent with our obligations under federal law as federal grant recipients to apply it uniformly. So we can't selectively use a lower rate for this costing without creating the kind of inconsistency that would trigger a federal audit or compliance risk.
So Bob, what I just heard you say is that 53% is not associated with the specific cost of increasing wages for the purposes of these negotiations. You told us the cost of full COLA and steps is 11 million, and that's not true. So let me just ask you this. So I want to go back to this example of someone's wages, a worker's wages increased by $5,000. And Judith, you're saying that the 53% applies there.
Mm-hmm.
Is because that person earns $5,000 more, are they going to get sick more?
Well, you're self-insured, so the claims are the claims. That's not a direct relationship at all. And I'm not a doctor, so those are questions I can't answer. Maybe if we look at it, so it's a blended rate based on actual historic costs for this district. It is 53%, meaning this, and these are actual costs. These are audited by an independent auditor in the ACFR that says, yes, this is what your health plan costs. This is what your life plan costs. These are audited costs for the year ended 2025. So the basis that this is built on is solid and verified. This is no different than large districts like Milwaukee budget teaching salaries out to the schools at average teacher salary. You know that it would be impossible to budget actual salaries because of teacher turnover and changes like that. So districts use averages. That's what a blended fringe rate does as well. So to say, well, this 5,000 is related directly to this is confusing to people, because when you use an average, and a teacher's going to say, well, I make 90, but you budgeted my salary at 50. How are you going to pay the rest of my money? Because another school has a teacher at a starting salary. That's what averages are. So that's what this is. It's a blended methodology that uses an average. And when you start to pull apart the components of the blend, it gets confusing. But yes, it's applied always to the salaries at that rate.
That's the difference between budgeting, right, and actuals.
Yes, and in the end, we'll have an audit that says, how well did we do with our budgeting?
Okay,
But
so the calculations you're talking about, though, I'm trying to follow you, are for the total cost for all employees, full salaries, and benefits. We're not talking about that. We're not talking about that. We're talking about the increased cost for a cost of living adjustment for current active employees. And MPS said it will cost 11 million more for these specific employees.
no, Amy, what MPS said is the cost of COLA would be 12 million. And then we provided you additional detail per your request and consistent with your request regarding the impact on the budget as a whole. And it's not fiscally responsible to ignore that 53% costing that's used for healthcare and everything else that's covered under that list, without running the risk of having a healthcare plan that's not funded or other benefits that are left unfunded. That would be fiscally irresponsible.
So if I'm going back to healthcare, and this is the line medical active EMDI for 155.5 million. That 155 million, there is no increase in the cost of healthcare purely associated with an increase in wages. There just is not. And MPS has said that they can't afford this increase, our proposal of full 2.63% cost of living to workers represented by MTEA on July 1st. But it simply will not cost what you have represented.
So, Amy, if I'm understanding your argument, you're asking that we pull out certain items from the costing and do precisely what that federal guidance doc that I had referenced earlier says we can't do, which is use a different methodology for how we calculate COLA for MTEA members than how we budget everything else in the district.
No, that's not what I'm asking you. What MTEA is asking is that you calculate the true impact of the wage increase. Only the cost associated with the wage increase. We're not asking you to change your overall budgeting practices. That's That's not what we're saying. We're asking that you calculate the impact of the wage increase.
Okay, and that's a document that's been provided to you. You're referencing the March one, and there was more recently, that was the March 25th, 2026 costing. I believe it was April 7th when we provided the costing with the true impact on the budget with the amended option 2.
Could you say the last part about the amended?
Option 2.
What
That's the more recent costing document, which was also provided to you.
from April 7th?
Correct. So that has those numbers. And your question was after receiving that, you asked us how we got at that benefit cost. We've provided you that information.
But the true actual tax benefit cost is $3.5 million. Like, that's what we're wanting to convey to you today, is that we have solved your cost problem. MPS can afford full 2.63% COLA on July 1st. And that should be a relief to every single person in the room. Because what MTEA would like to be doing is working with the administration to increase student enrollment and to address the hundreds of vacancies that exist in the district and the very real race that we are in to fill those for children when they return to us in September 2nd. So these are your numbers. We're using your numbers. It's not complicated. We've even identified more than 4 million.
So
4 million less than the 28 million you already told us in your costing that you can afford.
So the rate methodology used, that's the basis for the audited financial statements and where we are now financially in this year, has been applied to all wages. So in the past years, if it was 52% or 51%, when you got your steps and lanes and COLA, this same 50% rate was applied to those dollars. And at the end of the year, we still had shortfalls. The rate looks at the whole picture. I understand what your logic is. I really do. To say, well, no, these wages don't have an impact on this piece. But the blended rate is built in totality based on the history of the district. And you've historically got those raises every year, and they were budgeted at 50%. And I think I would agree with you. If we had surpluses at the end of the year, I would say, you're right, we budgeted too much for these and the cost came in less. But we don't, because the rate is built on the totality of the performance of the program. I know it's hard to understand. I'm sorry that it's so confusing. And what you say in isolation completely makes sense. And you would be accurate in saying you found us money if there was money left in the program at the end of the year, but there's not. We're always short.
So we don't find this confusing or complicated.
It is. Oh, no one
We-
here said it wasn't confusing and complicated.
We don't find this confusing or complicated. I just want to be
Okay.
clear about that. The true cost of full COLA on July 1 is 24.4 million. And MPS has proposed an option that you have said costs 28 million. That's very simple. It's not complicated or complex. You've already told us that you can afford 28 million. The true cost for COLA on July 1 is 24.4 million.
Amy, you're attempting to have that calculation both ways. You're attempting to strip it out of the argument regarding the true cost of you're trying to strip actual expenditures out of that calculation of the true benefit costs. That and that's the figure that we relied on in our budgeting, consisting with how the district has always done it and has built their budget this year. And you're saying, don't do that. Don't use 53%, use 17%. And then you can afford it. But those aren't real numbers. You have to base it off of the methodology that you use consistently. So you can't on the one hand say don't apply it and then say, oh, but if you apply it, you said you can afford it. And so as long as you don't apply it, then you somehow can afford it. The facts, Amy, and I'm glad you noted that it's not confusing and that you understand it, is that 53% is the number that we use in our calculations. Those are the numbers that are reflected on the document that was provided to you. If you substitute your numbers in on the benefit cost, when you look at the difference between the proposals, the difference is going to be the same in terms of what that cost of COLA. It's going to be the same difference in the cost of just that 2.63% increase, which under all of these proposals results in significant savings to the district, which, as you've acknowledged, has a real $46 million structural deficit that needs to be addressed. And I think the point that Judith made regarding the distinction between a district that has a surplus or a deficit is a very poignant point, and should be considered.
So we're not disputing that MPS is welcome to use, free to use 53% for full payroll calculations. That's what that number applies to. What we're saying is that it does not apply to the specific portion of wages that our members would receive if you prove the full 2.63 MPS employees deserve and which MPS can afford.
Require us to use the deficit calculation. Amy, that goes back to what I mentioned earlier. We can't use one calculation for everything in the district except for MTEA member COLA, in which you propose using a different calculation. We can't do it.
What is that regulation or statute that you're referencing, Bob?
I'll get you the exact site.
The federal grant green book.
Oh, go ahead.
No, I know it's the federal grant green book.
Yeah.
Edgar, EDGAR. I don't know what that acronym is. I do know, but I've forgotten. It's under the federal grant green book. It's a federal guide.
I'm looking back in my notes. I'll send it to you, Amy. I can't find it in my notes.
And that applies to costing and bargaining?
It applies to, it requires the district to apply its fringe benefit rate consistently across federal and non-federal activities. So in essence, yes.
And Judith, you said the name, the statute, the federal, is it a federal regulation?
Yes, it's regulations around the acceptance of federal funds. I refer to it as the Green Book. I'm not an attorney. I'm a practitioner. It is the Green Book from the federal government, and the regulation is called Edgar. It's the guidelines for grant accountability and reporting or something like that. And that isn't the right acronym, Amy, but
Mhm.
200 CFR Part 200, or excuse me, 2 CFR Part 200.
2 CFR Part 200.
Yeah. And to be clear, Amy, if MTEA wants to talk about budgeting methodologies, that's you're always welcome to set up a meet and confer and have that discussion. The district is always very open to any type of feedback that you want to provide, especially, as we start to contemplate the budgeting process for next year once this one wraps up.
So I think we would like to caucus so that we can look at the 2 CFR 200, the Edgar.
Okay.
Is the room next door the caucus room?
Do you want to plan to meet back at a certain time?
I can text you. Is that okay?
That's fine. Sure. Thank you. Yes.
Yes, okay. So to briefly summarize where we're at, we understand from our discussion today that MPS believes it is required to apply a 53% additional cost for taxes and benefits for accounting purposes, even though that does not reflect the true dollar cost specific to wage increases. And we will be making information requests asking MPS to prove its claims. Regardless, that set aside, based on our analysis of MPS's justification for its benefit costing, using MPS's own numbers as given to us, the true benefit cost associated with the wage increase should be 17% and not 53%. That's based on the real dollar impact of the wage increase only, not the methodology that MPS asserts they are required to apply to its accounting for the entire workforce payroll. Using the 17% calculation and MPS's numbers, the total additional cost associated with the full COLA on July 1st is 24.4 million. And based on MPS's proposals, we know that MPS can afford 24.4 million for a full 2.63% cost of living adjustment on July 1st, because it's $4 million less than an offer that MPS currently has on the table. And so we again urge MPS to agree to our proposal today so that we can ensure that our students' classrooms and schools are fully staffed for next school year, and that so we can jointly spend our time doing collaborative, productive work for the district around staff vacancies and student enrollment. And we can send that information request this evening before we leave.
Okay. Well, thank you for that. And certainly want to thank MTEA for being at the table, not just today, but throughout the process, and for agreeing to join us at mediation next week. That matters. These are hard conversations, and engagement is how agreements are reached. So thank you. It's been said, and I think it's true, that this is a really critical moment for Milwaukee Public Schools and for the students and families who depend on it. You've got an administration that's committed to restoring the fiscal health of MPS and and remedying the very real $46 million deficit that the districts faced. The more than 230 information requests already submitted and the hundreds of pages of documents provided show that real significant reality in great detail. And what we've done is provided you with 3 proposals, which again remain on the table. The option 1, option 2 as amended, and option 3, each one delivering the full base wage increase permanently to every employee in this unit. And the only question remaining is when. Those proposals differ in terms of timing. So we're grateful that MTEA has agreed to join us at mediation, but of course you don't have to wait until then. You can send us your counter proposal, that if you've got another idea of how to provide the raise and close that $46 million gap, Students of Milwaukee cannot afford for us to miss this moment. And so we welcome that engagement. Thank you.
Thank you.